in February, I got out of the shower one day and I raised my arm up over my head and I saw dimpling underneath my skin, under my breast. And it was quite large. It was probably about 2 inches. And I knew that that wasn't good. So I Googled it and found that that was one of the signs of cancer. So I immediately called my GP and got a referral to for a mammogram, which when I went in for the mammogram, first thing they did was yell at me because I knew I had been real busy. And I knew that even though I was real good about getting my annual checkup, when they'd give me that little slip of paper for the mammogram, I'd be like, oh, I can't go today, I gotta get back to work. So I didn't go. And I knew I was probably 4 or 5 years, but when I went there, it actually was 10 years and 8 months since I had had a mammogram. So when I had the mammogram, then they found the lump and told me I had to come back in for the biopsy. But in the meantime, they did an ultrasound and found the size of the lump. And I remember hanging on the wall of the exam room was a piece of paper with all these different sized dots on it. They were very, very tiny, all the way up to one about golf ball size. And I remember kind of chuckling and saying to the girl, just tell me it's not the bottom one, the golf ball size one. And it was. That was the size of my tumor. Surgery went well. I had chemo before surgery to shrink the tumor. I was a stage 3, so the oncologist treated me first with 8 weeks of chemo to shrink the tumor. The tumor was successfully shrunk and removed with the surgery. The surgery showed that there was no cancer in my lymph nodes. They did take out the sentinel lymph node. It was free of cancer and all the margins around the tumor were clear. Then I had another 8 weeks of chemo, a different kind of chemo. And then I came to RBOI for radiation. My husband came with me the first time, and we went and saw Dr. Carrascosa, and he kind of chuckled at us and said we didn't need to be here for another 6 weeks because I was still going through chemo. But he was very nice. He explained that it would be about 6 weeks and what the treatments would be. And then when I came back to get mapped for my radiation, Becky did the mapping for me, and she was just wonderful, very patiently explained everything to me. And then I started the following week, because I think I came in on a Friday, but I started the following week with my radiation. The technicians that have treated me have just been wonderful. They're so personable. Steve and Holly have been treating me the most, although I've met Erica and Melva and a couple of the girls from the Ocala office, but Steve and Holly were my main technicians, and we've developed a relationship in these 30 days. Just been a very relaxing and comfortable experience, which may sound a little weird, but in all honesty, it has not been unpleasant at all. I think we took my treatment a little different than a lot of people. We focused on it as a family. I have a great deal of faith, and I knew from the start the Lord promised me that I would be made whole, that this disease would leave my body. And so it's been an experience, it's been a trial for our family, but it's been a good experience because it's brought us closer together as a family. RBOI does treat their patients differently than any other doctor's office I have been in. In a lot of doctor's offices, you're cattle and they're shoving you through. No matter how nice they are, the surroundings are sterile, hospital-like, not conducive to calming you down when you're fearing what the outcome of your procedure or surgery or treatment is going to be, or your health. And here at RBOI, it's been, like I said, it's like walking into a home. You walk into the main lobby with the couches and the fireplace and decorations for the holidays, and there's a special waiting room for the patients with very calming videos that play. You are able to establish a rapport with the other patients that are there, that are receiving treatments, because you come at the same time every day. So you kind of buddy up with these folks and think about them and pray for them and wonder how they're doing too as they're going through their treatments. And then a lot of doctors' offices, you wait and wait and wait and wait to get in for your appointment. Here, I'm in on time. Sometimes I'm in 10, 15 minutes early, and I'm out, in and out. It's been a good experience. For a lousy situation, it's been a good experience.